Western medicine, we know it as basically high weight compared to height, or increased waist. There is a pandemic of obesity. There is, in 2 years ago, over 1/3 of world's population were obese, and there is a projection that about half of the population will be obese in 10 years' time. Obesity is multifactorial, so there are many factors, but it's mostly lifestyle choices, like poor diet and sedentary way of life. But there are many consequences to the disease, and some of them can lead to severe morbidities and death. In Western medicine, we would suggest that a patient who is obese eats properly and exercises. And for severe obesity, we would prescribe medications and even surgery. But the success rate of these interventions is very low. Only every 10th person will actually lose weight due to diet and exercise, and drugs will be efficient in up to 20%. So there is room for improvement, definitely. In TCM, obesity is looked as either spleen deficiency with dampness, gastrointestinal damp heat, liver Qi stagnation, and or kidney yang deficiency. There are several ways we can use acupuncture in treatment of obesity, and I will focus only on manual acupuncture. So there are many studies that have been done on this topic. In the past 20 years, over 350 studies have been published. And in meta-analysis, which are basically the highest quality studies, they have basically showed that it's safe and effective treatment of obesity. So we can definitely use acupuncture as an additive treatment. So what are the effects of acupuncture? So it's to reduce weight, of course, but there is less body fat after acupuncture, and a feeling of general wellness. So what are the mechanisms on the physiological level? So the needles would actually stimulate hypothalamus to secrete hormones, little hormones, peptides that regulate appetite, metabolism, and stress. And for example, we can use REN4 as one of those acupuncts, REN12, and the stomach 36 in this way. The other way the acupuncture affects obesity is by stimulating or regulating hormones. For example, it's been shown that acupuncture can reduce leptin levels. This is the hormone that regulates appetite. And for example, by puncturing stomach, sorry for this, stomach 44 and stomach 36, we could reduce leptin levels. I found this study very interesting. It was on people who had breast cancer, and it was about them feeling better with acupuncture, with a protocol named mind regulation acupuncture therapy. And the protocol was once a day, 5 times per week for 4 weeks for 30 minutes of needle insertion. And these were the acupoints used. And what the study found is not only that the people felt better, but also they had lower levels of this appetite. So they could regulate the appetite better. One more important effect of acupuncture on obesity is lowering the insulin resistance. I don't know why it's doing this, sorry. So basically what this study has shown is that by stimulating these specific points on the abdomen, which are mostly on the REN channel, but also on the stomach and the spleen channel, we can increase body's sensitivity to insulin and lower blood sugar levels. The points are as shown here. So REN 12, REN 9, REN 6, which are all on the midline on the abdomen, stomach 25 and stomach 28, and spleen 15. So, but stimulating large intestine 4, large intestine 11, stomach 36, and spleen 6. And I would just like to point out that these points I use myself, and they've really shown effects on lowering body weight. So which are the points that we should be using based on these studies and experiences? So it's stomach 25. It's a powerful point to regulate spleen and stomach and to resolve dampness and damp heat. Stomach 36 that we mostly use in almost all of our patients. We know that besides fortifying qi and nourishing blood, it also calms the spirit. So we do use it a lot in a lot of combinations, and should be used for this one too. And then stomach 44, it's acupoint that we didn't mention much, but it's actually a very powerful point to harmonize the intestines and clears the damp heat, which is what we want in treating the obesity. Then it's REN 4. REN 4 is also a powerful spot. It's meeting point of conception vessel with spleen, liver, and kidney channels where they all meet. So it influences all these channels. REN 9, which regulates water passages and treats edema. It also harmonizes intestines and dispels accumulation. REN 12, which is the front move point of the stomach and the meeting point of conception vessel with the small intestines and jiao and stomach channels. And spleen 6, which is a point we use in almost all protocols as it's the meeting point of spleen, liver, and kidney channels, but it also resolves dampness. Besides these primary points, we can use these points. For example, REN 6, which is the C of Qi. spleen 15, that's acupoint on the abdomen, close to stomach 25. It's said that it lowers the waist circumference. Large intestine 11, which I use a lot to resolve heat, especially from the head, but also can be used in treatment of obesity. Then the mind regulation therapy acupoints, which is large intestine 4, liver 3, and heart 7. Stomach 40 is acupoint, which is used for resolving dampness. And if you want to treat the back too, there are, of course, back shoe points for large intestine, kidney, and spleen. So in conclusion, acupoint is safe and effective treatment in obesity. There are many studies that have shown this to be a very powerful way of supporting healthy weight and exercise in losing weight in a healthy way. And what I especially like about this method is that it takes into account many of the aspects that lead to obesity. Yeah, thank you. And sorry, I don't know why it's continued to